tonight to talk about kind of body swing connection, but even more so like body speed connection. You know, what are those things that are really going to affect how fast you can swing a golf club, you know, connected in the physicality of your body. We're going to look at a bunch of different things. They're going to be really, really cool. I'm excited about this webinar. It's some of our favorite stuff to talk about. So here we go. Without further ado, I'm going to get my screen share going here. Okay. So the first major question that I'd really like to ask everybody that's there is, you know, what are those different things that affect, you know, how far any player hits a golf ball? And there's a lot of different concepts. There's a lot of different things that do affect how far the ball goes when you step up on the golf tee to hit one. You know, one of the ones that we've talked about a lot on our previous webinars, also just, you know, throughout our SuperSpeed golf training is going to be that neurological side. So that's, you know, really one of the big things that our SuperSpeed golf training products do, are they work on how fast your brain is expecting your body to respond whenever you make a golf swing. So we do that, you know, a lot with all of our SuperSpeed protocols. We're really working to increase that expectation of reaction speed to any motor program. But that is one of just many different things that can really affect speed and power, or your potential for speed and power in the swing. You know, another one that is incredibly important here about affecting speed and power is going to be actually the clubs you're swinging. So, you know, anybody that goes out, if you don't have a club that's fit for you properly, you know, the main issue there is that you're not going to be able to consistently line up a shot in the center of the face. You know, you're not going to be able to create as much speed and power as you possibly could throughout your golf swing, because you've got a club that doesn't fit you. This could be a shaft that's too flexible or not stiff enough. Could be one that's way too stiff and not optimizing your ball flight. I know a lot of you have probably seen our strike spray products, but that's actually one really good way to start to look at club fitting, to see what kind of different clubs you can more consistently hit the ball in the center of the face. Check that out at strikespray.com if you want more information on that one. Another big one is going to be the physical. And, you know, again, this is a major piece of what we're going to be talking about today on this webinar, looking at how different aspects of physicality or physical characteristics of your body could affect your potential for speed and power. I like to look at this in a real broad sense, and you guys might have seen this before in some of our previous webinars, but looking this on a scale of something we call the athletic ceiling of a player. Thinking of athletic ceiling is like the potential for any of us as human beings on how far we're going to be able to hit a golf ball. Okay, so let's say, you know, we have a player A who's 35 years old, maybe played golf in college and hasn't done a whole lot in the last 10 years. You know, that player most likely is not functioning at 100% of their potential. The other crazy thing that we've found is that it also is the same type of a boat. If you're a player that's on the PGA Tour, there's still a lot of room left in that tank to be functioning at even a higher amount of your own personal potential than what you currently are. So for a lot of you out there, I would imagine that you can probably imagine where you are on that scale. You know, we don't really have an answer. I'm not even sure there's a way to develop an answer to this one, but, you know, I would guess somewhere around the 60 to 70% mark is somewhere around where we would see most people function compared to their total athletic potential. So the next question we would look at is, what really determines your athletic potential? You know, the first one is going to be a pretty obvious thing, but it's genetics. You know, so everybody is, you know, has a unique genetic code, and that genetic code does have a major impact on the different amounts of different types of muscles and connective tissue and all those different things that happen in your body. There is a, you know, really good light here. It's not like one of those where if you're not blessed with the best genetics in the world, you're never going to be an elite player or have elite potential for speed and power, because there's another whole topic here that we call genetic expression. Genetic expression is basically looking at your development, looking at the way you go through different stages of development as a human being, and knowing that there's different parts of your genetic code that are going to have more likelihood to get expressed if you match up to the right training windows along your developmental chain. So what I'm saying there is that although we have this big genetic code, and that is unique to every one of us, we only use a small percentage of that genetic code, which actually becomes expressed in the actual cells in our body. So what's really cool about that is that, you know, somebody that trains well from a very early age and does the right things and works on speed and power when they're young at the right times actually can develop a much greater potential or higher athletic ceiling than their identical twin who didn't do any of those things. So that's a really cool idea here when we talk about genetics and genetic expression. One of the main things that this produces is going to be different types of muscle fibers in our body. Now, you know, golf's one of those sports where the golf swing doesn't take very long. If we look at the actual time that it takes to create a golf swing, it's about 1.3 seconds, okay? So if we look at that, that's like one of the fastest sprints in the world if we're looking at an explosive power sport like this. So what we're looking for there is, you know, players that have more fast twitch muscle fiber in their body tend to have a little bit more potential for speed and power. So that's one of the big genetic markers that we look at, you know, for seeing what somebody's going to be capable of. Now, another really key point to the physical side of this entire thing was developed by our friends at the Titleist Performance Institute. So TPI, one of their core philosophies is something we call the mobility stability model. And what this says essentially is that your body works in an alternating series of stable joints and mobile joints. So basically, you know, a stable joint is going to be one of those that only likes to move in one plane, one of the three planes of motion. You could look at your finger, your knuckle and your finger is like that. So, I mean, your knuckle definitely likes to flex and extend, but it doesn't like to go side to side. It doesn't really like to rotate. Now, it can move in those ranges of motion by a couple degrees here and there, but you really don't want it to because it's probably going to hurt. So that would be a stable joint. Now, your wrist, on the other hand, your wrist moves very freely in all three planes of motion. So we would consider that a mobile joint. And if you look at the diagram on the skeleton here on the screen, if you go through, basically every other joint in your body is stable, mobile, stable, mobile, stable, mobile, stable, mobile. And the core of that philosophy from TPI is that if that pattern's broken, there's probably going to be some type of dysfunction occur. Now, dysfunction can come in a lot of different ways, right? Dysfunction could be an injury. Dysfunction could be pain. Dysfunction could also be OB left on the first hole because of inconsistency, because of that physical limitation. So there's a lot of pieces here that are really important when we start to look at this physical side of the entire equation. The last one that really affects how far a player can hit the ball is going to be the mechanical. Now, the mechanical side of this, we like to break down at SuperSpeed into three major areas. We like to look at ground reaction force or ground mechanics, rotational sequencing and kinematics, and then lag and wrist mechanics. Now, again, you've heard us talk about the speed pyramid before and how these are incredibly important elements in order to produce maximum speed and power for any player. Well, what's really cool about this, though, is what we've done now at SuperSpeed is we've actually, you know, in partnership with a lot of our friends at TPI and the physical screening programs that they've developed, we've actually created some physical screens that players can do to give you an idea of if there's limiting factors physically that are going to affect your ability to use the ground or are going to affect your ability to create effective rotational sequencing or to create wrist mechanics and lag. So we're going to go through a few of those now, and I think it's going to be a really fun little thing to look at. The first thing that we like to look at is the foot. Obviously, when we're looking at ground reaction force or ground mechanics, you know, the foot is our only connecting piece between our body and the ground. So it's obviously going to be an incredibly effective or incredibly important aspect to look at how your foot actually functions. There's a few different things here that we like to look at when we're talking about the foot. The first one is one that we see commonly from time to time. We call it hallux valgus. So it's going to be when the big toe kind of bends too far in. You know, your foot should look like that one on the right where your toe goes relatively straight. So if it bends in like that, that tends to scrunch our toes together a lot. Also can cause pain and inflammation in that joint. This is going to be an incredibly, you know, limiting factor for somebody if they're really trying to push into the ground aggressively during their golf swing. It's going to make it very difficult to do that because anytime that we have pain or something hurts, we're going to shy away from trying to do that. So this is the first test we do is we look to see if the toes are going to be functional on a joint standpoint like that. The next one is something we call our toe spread test. So the toe spread test is pretty simple, and everybody can actually do this right now with us. Just with your foot in your shoe, or if you have your shoes off, see if you can actually spread your toes and get space between all 5 of your toes at the same time. Now, a lot of times it's that little pinky toe that really kind of gets stuck in there after a while. But this is something that becomes incredibly important as well when we're trying to really grip the ground with our feet. If our toes aren't functional, we're losing a lot of those connection points to the ground. And we can see this as a big correlation into a player that's not going to be able to use the ground effectively in their golf swing. The last piece that we really look at when we're talking about ground reaction force is balance and proprioception. So this one we look at in a few different ways. So we're going to look at the ankle joint. We're also going to look at a player's ability to balance in a single leg stance. So if we have a player, and this test is pretty simple, you can do this with us too. You just basically stand up on one leg with the leg thigh up to about parallel and see if you can get into that position. If you can't get into that position, that's basically you're already out. Now, if we get in that position, then we might try closing our eyes. When we close our eyes, that's going to actually activate a lot more of our proprioceptive nervous system, a really important system to consistency in golf, but also really key to our ability to be able to actively use the ground. Many of you people probably know this, but we have 3 main ways that we balance as human beings. You know, the first one is going to be vision. So like if you watch like professional dancers, you can always see this because they're always looking at a spot and then they might spin and they find that spot again. Vision is a major way that we're able to correlate up and down and side to side and keep ourselves upright. The next really important one that happens here has to do with little tubes in our ears that work like bubble levels. It's called our vestibular system. So that's another one that really helps us able to keep ourselves upright and keep ourselves balanced. The third one is proprioception, which is really one of the main things we're testing here, which is more field-based balance. So this is going to be little nerve receptors around all the joints in your body that send a signal back and forth to your brain. And if that signal happens fast enough, it keeps you standing up. It keeps you from twisting your ankle over a curb or all kinds of other things that are really important to field-based balance. For the golf swing in particular, this becomes a major factor in consistency. Because this also has a lot of correlation into the consistent response of a motor program. So here's an example there. Like you're standing out on the first tee and you stripe a ball right down the middle and you crush it and it was great. Next tee you get up and you know you're set up, you feel like you do exactly the same thing and the ball goes 30 yards into the right rough. Well, there is a possibility that that wasn't that you did anything different at all. In fact, your brain sent the exact same signal to your body, but with a poor proprioceptive nervous system and nervous response there, it's possible that there was enough variance that caused that face to be a few degrees open and hit the ball to the right, even though you tried to do exactly the same thing. I think that could be a really frustrating thing for golfers overall. So a really key one that we can look at. The last piece of looking at the ankles is something that we do called our ankle rocking test. So this one's basically just trying to put your feet flat on the ground about hip width apart and then trying to actually evert and invert your ankles. So basically lifting the insides of your foot and then the outsides of your foot like that, okay, side to side, and seeing if you can do that both from a mobility standpoint and a motor control standpoint. This is one that can have a huge correlation to sway and slide in your golf swing. Also can have a really big impact on your ability to be able to push into the ground on your backswing and your downswing. So all of those are big physical correlations that are really important to look at when we're talking about ground reaction force and how you're using the ground related to how your body works. I'm going to go ahead and hand it over to Daisy a little bit here, and she can talk about rotational sequencing in the golf swing.
All right, so all of you that
go ahead and share your screen actually, because I might not be able to hear you to get the slides up for you.
Okay. It's giving me a few options here. It's not letting me share. All plan lists. Yeah, not working. Won't let me share, Mike. Bear with us one sec. Yes. Okay. We got some action going here. All right, we're all good to go. All right, back to it. So we just talked about all the physical deficiencies that might cause you to leak in speed from the ground. Now we're going to talk about the physical deficiencies that might cause you to leak within your sequence. So the first screen that we like to look at is the lower quarter rotation. So that's specifically testing your mobility in your hips. Now this is very important. It can also cause things like sway and slide, like the ankle rocking test. But mainly it's going to limit how far you can rotate into your backswing, which will limit how long you can swing the club. So you want to have good hip mobility to increase your range so that you can get into better, more optimal positions. Also, if you don't have good hip mobility, you can tend to compensate from the knee or from lifting up your posture. So just some things to think about. Hip mobility is really important. To do this screen, you're going to stand, a TPI professional is best doing the screen, but essentially you'll stand on an angle, and we were looking to see that your hips can rotate a certain amount. The tour average there would be the hips level to where that dotted orange line is, right there. So if you're shy of that angle, then you need to do some work on your hips. The next one is the seated trunk rotation screen. Now this one is looking specifically at the thoracic spine rotation. It's probably one of the most important things to prevent injury while trying to build speed, right? Because if you build up that speed, but you don't have efficient rotation in your thoracic spine, then the rotation is going to come from a neighboring joint. So when we take a look at that mobility stability model, and if you get locked up in your hips or your T-spine, it compensates and you rotate from your lumbar spine, which is no bueno, okay? It's not good for your spine. You want to improve your thoracic rotation, improve your hip rotation, and that should automatically reduce that lower back pain. So obviously we want to build speed, but we want to build speed safely, because your body will only allow you to accelerate as fast as you can decelerate. And if there's any deficiencies in the chain, then your body's going to say, no, I'm not going to let you move that fast. So these are all intricate details to take care of your body. Moving on. So now, instead of mobility, we're looking now at dissociation. So the ability to separate your upper body from your lower body, dissociate, right? So that's really important in the golf swing, especially when it comes to sequencing, because if you can't separate, if you can't get to the top of your backswing and start the downswing with your hips, then there's an issue there. So if you guys all want to do this right now, you're going to stand up in golf posture, put your arms across your chest, try and turn your torso, keeping your lower body really still. If your hips start to move with you, then there's a limitation there and you can't dissociate. The same goes the opposite way around. So we test pelvic turns. Can you dissociate your hips from your torso? So the same thing, standing in golf posture, try and rotate your hips and see if you can keep your upper body still. Those are two very important things to create a good, efficient kinematic sequence. Another thing that we look at, because we don't just rotate, we actually tilt our pelvis. Our pelvis actually rocks backwards and forwards, transferring energy up the chain. So for this one, you get in golf posture and you're trying, imagine like you've got a big belt buckle on, and you're trying to point that belt buckle down to the ground by arching your back, and then round your back, trying to pull that belt buckle up to the sky. Now, some of you might be doing this right now and think that you got it down, but if you look in the mirror, your range of motion might not be quite as much as the professionals on tour. So this one's a key. You can gain so much more speed just from being able to pelvic tilt efficiently. If you take a look at all the major athletes, major sports and athletes in the world, whether it's tennis serve, whether it's a golf shot, a baseball shot, they all pelvic tilt. They chuck the energy from the lower to the upper and propel it through the instrument to help create more speed. So the last section is lag section. So specifically looking at the wrists and the arms and how they load and what physical limitations could affect how well you limit the club. So we start to look at shoulder rotation. I can hear my audio playing through mics now. All right, that's better. I don't have any feedback now. Good. So shoulder rotation. So when you're standing upright, if you put your arm out to the side at 90 degrees, elbow level with shoulder, and rotate back, you should be able to get that past spine angle. So you can see this lady here, the forearm has gone past her spine angle. Okay, so that's past. But if you're not quite there, then you can start to think about what things that might limit in your golf swing with regards to speed. Now let's take a look. The second phase of this one is the dropping it into golf posture. So obviously that range of motion is important to be able to set the club efficiently and not be too steep, but being able to stabilize that is incredibly important as well, especially with regards to stabilization and increasing in speed. So once you drop that into golf posture, do the same thing. And now we've added gravity and we're trying to maintain that range of motion. If you're the same as you were when you're standing upright, you pass. If you don't quite get to where you were when you were standing, there's a stability issue. You need to do more pulling exercises. The last few screens here, and then I'll hand it back over to Mike to finish up, is to do with the wrists. So we look at wrist hinge, radial and ulnar deviation. So for these, if you just put your elbows by your side, stand up and show you, elbows by your side, and we're looking at how far you can hinge ulnar and radial, okay? Then you're going to do rotation. So we're going to do our knuckles to see that we can get them parallel to the ground. So rotate out and rotate in, okay? And then the last one we do is flexion and extension. And for that one, we're not going to have our elbows tucked to our side. We're just going to push directly out in front of us. So we've got extension and flexion. If you're limited in any of these ranges of motions, then the chances are the motion's going to compensate and come potentially from your elbow, which is why some people might experience golfer's elbow or tennis elbow. So being efficient in the wrist is going to help you to load the club, create that lag angle, create that flexion in transition, which are all tendencies we see in players that create a lot of speed. So Mike, can you hear me yet?
Yeah, I can actually. So that is good.
Right.
I think a lot of these last couple things are really important. When we start to look, I think it's interesting that we start to look at what's going to affect leg and wrist mechanics, even the whole way up into the shoulder. But that really is where a lot of things happen that are going to allow your ability to load the club in those final couple segments. Now, the other thing, too, that I'd like to just kind of broad spectrum here is that if there's things on this that are hard for you, I look at that as potential. If they can get better, you might be able to even do better with speed and power than you're currently doing. Some of them are easier to fix than others, right? So like some things on this thing are really good to work on. I'd say the balance, proprioception stuff, everyone should be working on. Sometimes the way our wrists and hands move are just, parts of us, and they're not going to get a ton different. So sometimes there's also some really good ways to, might be a predictive factor of how you should grip the club most efficiently in order to maximize your speed and power in the swing. That's kind of the main point of the content we wanted to talk about tonight. So we'd like to open it up to questions. If anybody has any questions on any of this material, we'd be happy to answer them now. We also did want to just kind of announce this week a little bit that we're getting really close to having more information available on a new product that we're going to have coming out called our SuperSpeed C. It's actually a counterweighted version of our SuperSpeed clubs. In a cool way, that's actually going to be really targeted at sort of hand and arm speed in the golf swing, but we will have some brand new protocols coming out soon and that new product launching in January. So please be looking out for more information coming soon on that as well. Daisy, you want to go ahead and look at some questions here and we'll start to answer them?
Yeah, we actually have one that's not related to this content. So if you guys want to start shooting messages through the chat or Q&A so that we have some to answer, that would be great. But for now, let's answer this question. Even though it's not related, I think it will be good information for everyone. So this is from Philip. I'm in the midst of phase 3 and I get it to about 95 to 100 miles per hour, but I use the yellow, green and blue. Should I get the red club?
Yeah, couple pieces there. It really mostly depends on the driver that you're playing. So like if you want to play a standard men's weighted driver, like something with like a 65 gram shaft or heavier in it, you should definitely be using the men's set. If you're using that lighter weight club still though, if you have an ultralight shaft in that driver, 40, 50 gram shaft, it really doesn't matter how fast you get your swing speeds to, I'd still prefer you to be in that senior set.
Hope that made sense for you. We still don't have any questions. Oh, one. Brett Cohen, any suggestions to improve ulnar deviation with stretching or exercises? I actually like to use Indian clubs. I don't know if any of you guys use Indian clubs, but they're look like bowling pins, and that can actually be good as like if you're swinging it round the head or working on upper body stability, it can actually help. It pulls it into ulnar deviation a lot more. You can also do some exercises using dumbbells or small weighted bars to help with those ranges of motion too.
Yeah, I think, again, wrists are one of the most difficult pieces there to really change range of motion on. It's certainly possible, but I'd highly recommend, you know, especially getting that player looked at by a medical professional prior to really starting to use a lot of exercise to stretch the wrists. A lot of complex little bones and things that happen in the wrist joints, and they can be injured really pretty easily, and they're really hard to come back from for golfers.
Yeah, for sure. If you're hitting a brick wall with that range of motion, medical pros the person to go to for sure. Good question here coming from Africa. What's the importance of bilateral movement, swinging both ways, for neurological improvements in speed, especially for kids?
Yeah, I mean, we can talk about that all day if you want. I think the non-dominant training stuff is really, really huge. I mean, for juniors especially, you know, balancing out the body and being able to create speed, both acceleration and deceleration in segments, both directions, which is an absolute must for creating that really high level athletic ceiling, right? Like you look at some of the fastest players in the world. I mean, a lot of them were hockey players actually that were swinging a hockey stick the opposite direction they swing a golf club. So, you know, there's a lot of research there on how non-dominant training can produce elite potential for speed and power. I think the younger kids can do that, the better. But it really, the science of it goes into the kinematics about really making sure that those deceleration chain muscles are firing and are strong and are functioning as efficiently as possible.
Yeah, for sure. This is another question coming here from Edward Gill. I have a Pee-wee set, all-star set, junior set for my junior golfers aged 6 to 8. How important is goal swing form versus just seeing what speed they can swing that club?
I think they're both important. I just think they're completely separate. I think when you have them swinging those super speed clubs and you're trying to get them to make that thing move as fast as humanly possible, I'm not telling them anything about form. At the next, you know, stage, like maybe we're working on ball flight control or something else, that would be definitely a different opportunity to work on maybe club face position, form, those kind of things can become more important in those other areas. But I would separate them out for sure. I will say this as well. If a player, and I would just throw this out as a kind of broad 30,000 foot view statement, but regardless of what sport you're playing, whether it's golf, baseball, tennis, if you're able to swing a golf club, let's say 10 miles an hour faster than you were able to swing it, you know, in a previous state. So let's say you started and you were at 80 miles an hour, and then you went through a training process and then you were swinging it at 90 miles an hour. Theoretically, it's impossible to do that without having somehow improved the efficiency of that player's mechanics. Now, again, there's a lot of different pieces there, and the skill elements of the sport are incredibly important to golf. So you still have to work on all those skills, but from an athletic efficiency standpoint, if you're improving speed, you are improving athletic efficiency.
Perfect. All right, this is a great question related to the topic we presented today. What's a good exercise to work on spreading your toes?
That's a fun one. There's a lot of them, right, Daisy?
Yeah,
There's actually some little devices you can buy, I think, are some of the best. There's actually these little like kind of gel toe separator devices that you can get. Those work really well.
Toe spreaders, and then also like heel to toe raises that are in our dynamic warm up. If you do those barefoot and work on as you go up into your toes, spreading your toes, that's another good one too.
Anything that you can do to try to improve dexterity in your feet. So like trying to pick things up off the ground with your toes, anything like that is going to start to improve that area. Now, obviously, there's differing levels of issue that can be here. You know, if it's minor, I think some of those things can work. If it's more major, sometimes you have to start more on a mobility side, maybe taking a dowel rod and spreading it between your toes a little bit just to stretch them out. There's a lot of different things that you can look at there, but that is definitely one that I think every golfer should be working on.
For sure. So I just had a question in there and I accidentally removed it, but it said that he's 61 and he's obviously not going to be able to create much more fast twitch at his age, but what can he do to create more speed at that age?
Yeah, well, at that age, it's look, after you're in your early 20s, you're not creating any more fast twitch muscle fiber. Like, you're pretty much done developing at that point. The idea is not to create more muscle fiber, not to create those things. It's to utilize more of the speed that your body's already capable of, and that your brain neurologically is shutting down for one reason or another. Like, there's a lot of reasons that people go down that chain, down that staircase of athletic potential. And a lot of them are injury, pain, previous type things like that. Even, maybe trying to work too mechanically in your golf swing can also affect that negatively. So breaking through some of those barriers and accessing speed and power you already are capable of is one of the main reasons we see so much success with our super speed golf training.
Yeah, especially in the older populations as well. That's why we see a lot of success. Another good question here. When I'm working with a student who is limited in multiple areas of mobility, where do you start? Ground up? It's a good question.
Go for it, Daisy.
I think it just depends on what they can do and where they're stable. So if they're someone that literally is really immobile, you're not going to try and get them to rotate into their right hip, get their arms up high, turn their torso, because they're not going to physically be able to do it. So I would start with some ground up drills, potentially our step drill or our heel stomp drill. Those are all great drills to work on things from the ground up. Just understanding that while you're working on those things, there's going to be some limitations with their movement, and just understanding and working with them to try and find something that suits them for the time being, to create the best results with what you've got. Then you can send them off to a fitness medical professional to work on those mobility deficiencies, and you'll see swing improvements will translate to their swing.
Yeah, I think another way to say that too is it depends on what the player wants. So if it's a player that's incredibly limited in mobility and their main goal is speed and power, I think then, you have to look at that on a couple different levels. What are the things physically that are going to be able to change quickly? What are those that are never going to be able to change? If I'm working with a medical or fitness professional with a case like that, one of the things that I'm going to look at is the ones that are probably not going to change. Like, if there's, real like joint issues that are probably not going to improve in range of motion or strength or stability, as a coach, I'm immediately going to find workarounds for those. So I'm going to say, okay, we're going to need to create still this range of motion. So we can't get it from the hip. Let's get it from lifting the heel off the ground. Or I'm going to find ways to work around the ones that won't get better. And then the ones that we do feel are going to get a lot better, in those situations, we'll maybe save those for later, do the ones that we can't fix first in the mechanical side. And then as those other things improve, start to help that player with some different range of motions in the areas of their body that are getting better.
Love it. One comment asking if you're going to see us at the World Golf Fitness Summit. You will. We'll be there.
Absolutely. I believe we've already signed up and have a booth. So we are going to be at the World Golf Fitness Summit for sure.
Yeah, so come see us.
Yeah, absolutely. Come see us. We'll certainly be submitting talks and different things to potentially present there as well. Hopefully we'll again get to do that.
Awesome. So I'm trying to find some more specifically related to the physical side. What is an ideal combination to create lag given normal wrist capability, and how to use super speed to maximize it? This is from Matt Cluck.
That's a good question. So I think lag is a very complicated situation that I think we as golf coaches try to talk about too simply. There's a lot of times that more actual lag angle doesn't necessarily create more swing speed if you're in a situation where that's going to decrease the overall length of your golf swing. So it is important to note that creating more range of motion, a longer golf swing, or more kind of ramp time for that club to accelerate down toward impact will create more gain in ending club speed than creating more angular change in the lag. I think the best case scenario here is looking at lag as something where you want to find an ideal amount for each player where they can most consistently strike the ball and create good centerness of contact. And then once you get that optimal place for each player, then you start to find other ways to actually optimize speed and power. Um,
And I like to
That's
add to that
one
as
of those
well.
where it's more important that you're creating a little bit of downswing loading than you're creating, as much as some long drive professionals do. It's more of a major issue when you're not creating any downswing loading or casting or releasing the club early, where you're going to see a major deficiency in speed and power because of it.
I think more specifically, we're trying to answer the question like how to use super speed to maximize it. We actually have a specific protocol to work on lag. If you go to our website and go to training, under at the bottom there's these 4 tabs. If you click on advanced training, advanced speed development, you'll see our protocols there. And we recommend at around week 20 into training that you check those out, test yourself for our 3 components of speed that you saw today in our speed pyramid, and start implementing those specific protocols to work on those weaknesses. So the lag sprint protocol actually requires you to make 8 reps in rapid succession, and that will help with them creating that load on the club if they struggle to create that feeling. All right, next question. If someone can't radial or ulnar deviate, what's the compensation you normally see? It's from Sean Kennedy.
Yeah, I think there's a couple different ones. I think the most common one is that player definitely better be bending their elbow in their swing. Because, if you look at the next joint up that you can create any range of motion for lag, it would be your elbow from your wrist. So if somebody can't really do that at all, they'll definitely in their wrist create more flexion and extension, because that range of motion can also create downswing loading. So you'll generally see that player isn't going to be maxing out lag compared to somebody that has a lot of range of motion, but there's definitely ways. They'll do it more with flexion extension and more with the elbow.
Love it. This is actually a cool question. I've not been able to repeat speeds I've seen when swinging a driver without a ball, when I actually hit a ball. So for example, I see ballless driver swings, so driving without a ball, in excess of 100 miles per hour. Then when I actually try and hit the ball, I'm down in the low 90s. This is a good one, Mike. Over to you.
I think the way I would say that is don't try to hit the ball when you've got the ball in front of you. So obviously your body's capable of creating that speed. It's a mental block that's in there because the skill idea, you're worrying, if you will, about making good contact with the golf ball instead of allowing your body to be athletic and create that same speed that you were creating with the dry swing. So what I would do is, make a few swings and create that 100-mile-an-hour speed, and then maybe step up to a ball and don't even look at it maybe, but try to make that exact same swing, but let the ball get in the way.
Yeah, another thing that I like to do, especially if you see that loss right before impact, is when training with the super speed or even with your driver, put the radar out in front of your ball position. So where your driver ball position would normally be, stick it further out towards a target, and that will encourage you to try and release through and get the speed through the ball. So those are 2 good things that you can work on there. Let's see, reading through these here. Is there anything in particular that you would recommend in terms of improving elbow function or mechanics, i.e. golfer's elbow or tennis elbow, massage, active release, etc.? I can take this one if you want, Mike.
Go for it.
So normally, as I was talking about earlier, if that mobility stability model, if your shoulder, which is supposed to be mobile, gets locked up and restricted in range of motion, then the neighboring joint will compensate. So that could be the elbow. And if your shoulder and your wrist, which is also supposed to be mobile, if both of those guys get locked up, that's when the compensation starts to come from the elbow, and that's when you get golfer's elbow and tennis elbow. So working on shoulder mobility and wrist mobility will relieve the pain on the elbow. You should be able to get them into better positions too.
Yeah, I think a lot of it can come from different mechanical issues that are happening in that player's swing. Like, generally speaking, like tennis elbow on the outside of your elbow, when you're into a lot of extension with your wrist throughout your golf swing, can generally irritate that. And golfer's elbow, which honestly is actually a lot less common with golfers than tennis elbow, when you're in excess flexion throughout the swing, you can start to get some irritation on that side of your arm. I would say that if you have somebody that's complaining seriously about either golfers or tennis elbow, I'd look very specifically at the way they're using their wrists during their golf swing. And I think in many cases, slightly altering some of those mechanics, there's probably something happening excessive there that's causing that excess strain on the elbow.
Yeah, exactly. Africa, what's the best super speed exercise drill from the super speed protocols to improve vertical force? I would say the heel stomp drill. Would you agree, Mike?
Yeah, I think heel stomp drill, any of those drills where we're really using footwork on the ground in a more effective way, all of those are going to have an effect on vertical force. The heel stomp drill is the most, I would say, targeted directly at vertical force.
Yeah, exactly. If you haven't seen our heel stomp drill, go check out our protocols on our website. Okay, will you be having any seminars or certification opportunities at the PGA show this year?
Our certification program is all online. So we haven't actually launched a live version of the certification program yet. We're in talks with a few different PGA sections actually to do some kind of in-house live certification workshops. So those might be coming next year. At the PGA show, though, we're not doing anything like that at the show. I know we'll be speaking at the TPI Fit to Win stage. We'll also be doing events all week. We'll be out at Demo Day all week. We'll Demo Day on Tuesday. We'll be at the show all week doing tons of different meetings and interviews and things at different times. So you'll definitely hear from us down there, but no organized events this year.
Yeah. So the last question on here is, are these testing protocols, or I think you meant the testing assessments and the pass-fail criteria on your website? This not on our website, this is part of our workshops. If you come to our workshop, you will get fully screened for all of these and get answers as to where you're leaking in speed. But you should go to mytpi.com and look for find an expert, type in your zip code. You should find a TPI certified expert near you who can do these screens to you and actually give you good answers to help you with your game. And I think we have another one just popped in. Have you looked into overuse injuries in juniors using SuperSpeed? How should I mix up the protocols or exercises to avoid this?
We haven't had a lot of reports of any type of overuse injuries with kids. Obviously, we're not hitting a ball here. So the protocols for juniors are actually fairly short in the reps. And because we're not hitting a ball, there's not a lot of risk for injury. I would just look at our website and actually look at the junior specific protocols. They are a little different than the adult ones. We've seen nothing but really good success with a lot of the junior protocols that we're doing.
Yeah, those are called the super fun protocols. They're normally for 5 to 8, but if you have a kid that's 10 who loses his focus a lot, then have him do the super fun. But yeah, those, you can mix up those exercises that we put in between. So like frog jumps we do as like jumping squats, grasshoppers, broad jumps, and cheetah sprints. You can change those out every few weeks just to vary it up. But those we have found to be very successful.
Absolutely. Well, I think,
right.
Daisy, maybe we wrap it up there.
Yeah, that's it.
All right, guys, really appreciate you spending some time with us tonight. Be looking for a bunch of new stuff coming from SuperSpeed here in the next couple months. We're really excited about some of these new product launches and things. And then sure we'll see many of you down in Orlando for the PGA show. And until then, we're, keep getting out there and keep getting faster.
Yeah, thanks for your time, everyone. I look forward to seeing you next month for our next webinar.